Well, President Obama makes his case for health care reform this week when he addresses a joint session of Congress on Wednesday. The president is working to regain his footing on this contentious issue. So what does he need to say, and will it work? Joining me live in studio is Democratic Congresswoman Yvette Clark of New York, or as we like to clarify, Brooklyn. And joining me live on the phone is Republican Congressman John Fleming of Louisiana, who's also a physician. And we're happy to have you both with us. Thanks for joining us.
Good morning, Alex.
All right, Representative Clark, I'm hoping you're all mic'd up now. What has the president not been able to communicate that you expect he will be able to on Wednesday?
The president will just bring clarity to this issue, and I think it's really important for the American people. The uninsured in America are working people, are people who deserve this as a right. And I think that he's going to bring real clarity to that and give marching orders to the Congress to get this done.
So you think he's going to pull some political muscle here?
It's important. Yes, he is.
Okay. Representative Fleming, you're a physician as well as being a congressman. So what do you expect to hear from the president Wednesday in his speech to Congress? And what could he say? Is there anything that would get you on board with health care reform? What do you want to hear?
Well, absolutely, Alex. I actually ran in my campaign on the idea of health care reform. But I've said all along, and my colleagues on the Republican side, and now the American people, is that a government takeover of the health care system is a non-starter. We submitted H.R. 3400, the Republican alternative, which does address all of these problematic issues like pre-existing illnesses, coverage for those who are small businesses and the employees that work for them, and many other issues that we're dealing with today. We can solve all those problems through common sense reform without a government takeover. We know of no business model where government runs medicine that actually works.
Well, you might have a difference of opinion here in studio because, Representative Clark, I know that you support a public option. If the president is willing to abandon the public option to try to reach some sort of a compromise on health care reform, reaching out to the likes of Republican Congressman Fleming there, will a lot of Democrats in Congress abandon him?
I think that he's going to have a real hard time with us. You know, the American people recognize that there must be competition in the market. This is all about the insurance companies. And at the end of the day, they have not been acting in good faith. American people realize that their premiums are going up, their deductibles are high, they can't afford to cover themselves and their families. The only thing that drives that down is a public option. And in my constituency, they understand what that means. They understand it's not a government takeover, as has been distorted by the opposition to a public option. It is the one thing that we can do that actually brings reform to health care.
Representative Fleming, we've seen a lot of Republicans come out against the president's plan. Are Republicans offering an alternative here besides just saying no?
Well, yes, I just mentioned H.R. 3400. In it includes creating competition by doing away with archaic insurance laws. Right now, you can't buy insurance across state lines. Small employers can't aggregate their employees into large buying pools. So there are many very good ways that we can increase competition, which will drive services up and prices down.
But this H.R. 3400, how many representatives in Congress are behind it?
I would say virtually all the Republicans. It has more co-signers than H.R. 3200, the Democrat version. And again, the American people, after the August recess, you can tell